Hello everyone. Today I'm actually excited because the idea of this webinar came up in September last year. At the time, the Young Federation of Public Health Associations prepared a webinar about learning from young public health experts. I joined that webinar out of curiosity, and there were more than 60 participants, but I was the only person from Africa besides Dr. Luando, who is the vice chair of the Young World Federation. And I thought this preparing a webinar for us to gain the experience and also learn from public health experts from our region would be very crucial because we have a lot of experienced people, but we don't gain the opportunity to interact directly with them. So this platform gave me the chance to meet my goal and also my vision of creating an opportunity not only for the participants but also for me to learn from the public health experts that we do have. So we are joined today by amazing speakers who are invited to discuss on different topics. The first speaker is going to be Dr. Engelbert Nontera. He is a public health physician. He's also a clinical epidemiologist and global health researcher with a research focus on chronic cardiovascular diseases in aging African populations. He also works with Navrongo Health Research Center under the Research and Development Division of Ghana Health Services. He was actually in Addis a few weeks back for an Africa CDC training. I couldn't meet him in person, but he was invited by my uh, colleague Nuha Fufana, whom he knows. But I know we are going to have a very good discussion with Dr. Engelbert. So back to you. I will leave the floor to you, Dr. Engelbert, for 15 to 20 minutes for a beautiful discussion.
Thank you very much, Ebenezer, and good afternoon and good evening, depending on wherever you are. To both of you, the organizers and the audience, I'd like to actually put off my video just to improve upon the bandwidth, and then I'd like to share some few slides. So I'm particularly pleased to join you in this webinar, and as part of the Global Public Health Week celebrations, I guess this webinar is quite timely, as it's meant to, get the youth represented so much more in global health. And the focus being leadership in global health in itself is quite great. Given the, demographics of Africa, youth generally play a key role in most aspects of our healthcare delivery. I've been asked specifically to speak on African public health challenges, regional priorities, and the role of the youth in global public health. And as part of my talk, I would cover topics relating to the public health architecture in Africa. I'll highlight a bit more on some of the challenges, which I'm sure we all know and are quite familiar with, depending on our settings. Then I'll look at corresponding regional priorities, and then conclude with the role of the youth in global public health. As I indicated, this is the topic that I was asked to share some thoughts on, and I've broken it down into certain components just to help us have a fruitful deliberation. And I'll look basically at the public health architecture of Africa. I'll take a dive into some public health institutions across Africa and how that is organized and the legal frameworks that guide some of those institutions. I'll take a look at challenges, some regional priorities, and conclude with how the youth can be involved in global public health. So, yeah, as you can see from this slide, public health generally is organized differently based on the country that one finds themselves in Africa. And these different public health institutes are guided by certain core principles, or what we call essential public health functions, that have been outlined by our regional and global partners that offer some policy guidance in terms of organizing public health across the continent. So if you look at the slides, we have some of the essential functions outlined by WHO, Africa CDC, and the International Association of National Public Health Institutes. So you would notice the core functions range from monitoring evaluation to advocacy, as well as advancing public health research. And you see this cut across all the bodies that have these recommendations. So different countries have different national public health institutes, and they have been formulated based on these key principles. You would also notice that for some of them, there are legal frameworks backing the formation of the institutes. For instance, I know in Ghana, we have what we call the Ghana Health Service, which was brought about due to an act in Parliament, and that was formulated in 1996. And you have in other countries, the legal framework that guides them is either through some form of regulation or executive decree that mandates the formation of some form of an institute that will coordinate. And you'll see that across most of these countries, the primary function basically is leadership and coordination of efforts, as well as resource mobilization. But then just to also add that in other countries, the need for public health institutions was brought about due to some public health events. So if you take the Ebola outbreak in West Africa, for instance, following the outbreak, most countries decided and saw the need to have a body that will coordinate. So Liberia was a clear example, where in Liberia, following Ebola, there was that accelerated enactment of a legal framework to have a National Public Health Institute formulated. But in other instances, the need has come about due to the pressing desire to have effective coordination, effective resource mobilization to meet emerging threats to public health, peace and security across those countries. So different countries, different frameworks, but the core principles and the essential functions all align to WHO, Africa CDC, as well as International Association of Public Health Institutes. Now, if you look at this map, basically I've highlighted countries that currently have some form of a national public health institute. So if you look at West Africa, you would see there are several countries there. I think currently we have about 11 countries with a framework. In East Africa, you have close to about 10 countries, and the list is in Central Africa with 4 countries having some form of national public health institutes that are supposed to guide the operations of public health in those countries. Now, if you stretch it further to look at the health landscape, there's a lot going on, and over the past decade, there has been several changes in the African continent. You can't talk about these changes without mentioning demographics. We have observed an increasing, change in our demographic architecture in Africa. So even though we do know for a fact that we have quite a very young population, in fact, Africa is described as the youngest continent, or the continent with the lower mean age or average age, there's that huge bulge in that young population. But in recent times, we are beginning to see an increase in the number of older people because life expectancy has increased quite drastically, due in part to the fact that we have been able to control some of the common diseases that used to cause mortality. So if you take HIV/AIDS as a clear example, there's been a massive scale up of ART. So that has led to improved survival, and that has led to increasing life expectancy. So we are beginning to have an increase in the older population, despite the fact that there's a huge bulge in the younger population. And currently about 60% is in that younger age group. Coupled with this is this phenomenon of rapid urbanization or development. You would notice that most African economies are known to be rapidly growing. If you take the global world as a case study, most African countries are rapidly developing. And you notice most rural communities are now being urbanized. But of course, this urbanization also comes with it certain significant changes in either lifestyle or some form of our diet has also changed significantly. You would notice post World War II, there has been that industrial revolution. Though Africa has been slow in catching up, we've been able to get to a stage where we're looking more at getting sustainable agriculture to support living and to overcome food insecurity. So we're investing more in preservation of foods and putting foods in forms that can last longer and be consumed over a longer period of time. That has led to a bit of a shift in diets. So we are consuming more high-calorie diets, and this coupled with lack of physical activity creates an imbalance and also comes with it a challenge in certain form of certain diseases, including chronic non-communicable diseases. And of course, that shift in disease profile, where we are beginning to see more NCDs coming up, that's non-communicable disease, is often termed as what epidemiological transition, where we are moving gradually away from predominantly having infectious disease being a cause of morbidity and mortality to having much more of non-communicable diseases. And of course, we cannot talk basically of the African continent without mentioning the several social upheavals that are, taking place in several parts of Africa. So you would notice we still have lingering wars. Even within countries, we have ethnic conflicts, we have chieftaincy conflicts in smaller communities, we have insurgencies in the Sahel region, and all these have implications for public health. And that's why I'm highlighting some of these, the landscape across Africa and some of the things that can pose as a huge challenge. We also know currently global climate change is an issue globally, and temperatures are quite rising. Average temperatures are quite high now. This has implications for droughts and in some areas, famine, food insecurity. And of course, as we try to advance agriculture production, there's that exposure to pesticides, weedicides. And if you look at the composition where you have more organophosphates in these compounds, there's often that risk of exposure. They also cause endocrine disruption, and there's a risk of driving obesity, even in agricultural communities. Then last but not the least, you are aware of natural disasters. There are some that come freshly in mind, including recently in Libya. We have mudslides. I think in Ethiopia, there was a recent mudslide. We have some floods in South Africa. Last year, Ghana also experienced severe increase in rainfall, leading to flooding in some key areas. So the African public health landscape is shaped by most of these events. And these events can either present as challenges or opportunities for us. So just to continue, this slide basically summarizes some of the public health challenges that we have in the African continent. And if you look at disease burden, as I indicated, in as much as we have infectious disease still being a leading cause of morbidity, you would notice our demographic structure in itself, coupled with changes in nutrition and the epidemiological shift to chronic diseases, is creating a situation whereby we either have a double burden of disease where these two coexist, or in some instances, you have a triple burden of disease where, aside infectious and non-infectious disease, you still have this phenomenon of pervasive and chronic malnutrition. So different countries have different burden, whether double, triple, but there's some form of burden of disease that can overwhelm the health sector. Then, of course, outbreaks are not new to us in Africa. And as Nuha and myself were in Africa CDC last week, we did learn of the fact that at least we get about 100 outbreaks annually in Africa. And you are currently aware of the Mpox, the Marburg, and a whole lot of other outbreaks that are occurring across the African continent. Then, of course, I did mention internal displacements of people. But of course, despite all these things, one of the key things is that in Africa, our health systems are quite fragile. We are not set up in a way that we are strengthened enough to be resilient to some of these things. So we have very poor surveillance systems, and that leads to a delay in even detecting some outbreaks and putting up some preparedness or response to these outbreaks. This coupled with poor infrastructure, deficits in logistical support, and of course, inadequate workforce, which is brought about by migration of skilled labor to other countries in search for greener pastures. All these things play a major, huge challenge on our public health system in Africa, public health system in Africa. And then finally, public financing is a key issue. You would notice that most countries spend less than 1% of their GDP on health, and that is quite inadequate. And you notice we tend to be more donor dependent. And in instances where we have even had universal health coverage through some form of health insurance, this is often inadequate. So you notice benefit package does not cover essential components of health care delivery. So people are meant to pay out of pocket. So the increasing out of pocket payments leads to some form of burden on individuals. So in terms of public health priorities, these can be organized in line with the challenges I've outlined. I did mention disease burden as a huge challenge. And I guess in setting our priorities, right, we should be more focused on how to tackle some of these diseases that are occurring within the African region. And as we do know, vaccinations and immunization are a clear-cut way of controlling most diseases. We do know research is a key component. And even now, as we know, WHO has so many legal frameworks that guides even the emergency authorization for certain drugs to be used in emergency settings. We do know there's been, COVID at least has given us a lot of lessons to understand that even production of vaccines, the timelines have been shortened due to technology and much of what we have already known from molecular and epidemiological monitoring. So we need to improve upon research and development in the African region, focusing more on some of the specific diseases that we forecast to be able to cause outbreaks in our setting. Then, of course, I indicate routine surveillance monitoring is important. That will help us to know baseline, disease occurrence and be able to predict emerging threats that may happen. We cannot talk about our priorities without highlighting emergency preparedness and response. I think African CDC is leading the way with so many legal frameworks and recommendations as to how this can be done. So how you can do effective surveillance and how you can prepare for emergencies and respond to them. So African settings and healthcare settings need to build some resilience, build capacity to be able to respond to these emerging threats. And of course, I indicated we are rapidly developing. So most rural communities are beginning to become more urbanized. But of course, there's still that rural-urban differences. So we need to bridge the gap in those health inequalities between rural settings and urban settings. So we need to ensure equitable distribution of healthcare services, including infrastructure and the actual services that are being rendered. And culturally, there are certain imperatives that can impact upon health, including gender-related norms and cultural beliefs that can affect health. So we need to focus more on prioritizing how to deal with some of these inequalities, be it gender or rural-urban differences. And I did mention policy and governance. So we know in our at the national level in our various countries, we have ministries of health and other agencies that are, tasked with coming up with policies. And I guess this needs to be strengthened and aligned with regional frameworks or regional bodies that are vested with the mandate to, coordinate an effective health delivery system, including emergency response. So governments must be up and doing to have the political will to enforce policies and try to take lessons from best practices. In this era of innovation and technology, we know we cannot do without it. I mean, this is the technological age. And in having solutions to public health challenges addressed, we need to consider most of these innovative approaches or solutions. Telemedicine is one key example. Now, in AI diagnosis, there's a lot happening. If you look at tuberculosis, you would realize that there have been AI-driven algorithms that have been used to help in diagnosing tuberculosis through even the deployment of mobile X-rays, and then algorithms help to get probable or presumed diagnosis, which can then be confirmed clinically or with other laboratory measures. So all this need to be integrated as priorities as we set up to be able to control some of the public health challenges that confront us. Finally, mental health cannot be overlooked. And because we're speaking more about the youth role, we notice that there's this high abuse of substance among the youth. And in recent times, there's been this phenomenon of a drug currently in Ghana known as the red tablet. It used to be tramadol, they say. Now there's a tablet that has come up called red. There's so much abuse among the youth. So mental health issues, including looking critically at substance use, should be one of the priorities that we should highlight in the African region. Then in terms of financing, we did talk of the fact that financing is inadequate. So we should look for innovative ways of getting money. Domestic mobilization should be key. And I'll end it by talking about the community. People are organized in communities, and whichever policy we craft, regardless of how very good and effective it is, If it is not welcome and accepted by the community, there's no way such a policy is going to see the day of light. So it is important for us to make sure our policies are context specific and they address specifically community needs. One way of ensuring that the community actively participates in health is through strengthening the primary healthcare system so that it serves as a good conduit between the community and the health sector. There can be a cross exchange of ideas. There can be proper health promotion carried out at that level. So we should always bear the community in mind in whichever effort we make at prioritizing our health needs. And then finally, to the youth. I mean, I just need to end this with how the youth can be involved. And I have this illustration. And before delving into the illustration, we know the youth constitute about 60% of Africa's population because basically we're a young population. But it's projected that by 2030, 42% of the global youth population would be made up of young Africans. It therefore means that the youth can be a powerful tool when coordinated effectively, and they can be a powerful force of change for many of the health-related solutions that we wish to proffer. And now, if you look at the diagram to the right, this diagram, you would see there's different hands, different tones pointing to the globe in the middle. If you look at the details in the hands, you see that you have symbols of sports, you have symbols of agriculture, education, health, and a whole lot. This highlights diversity in purpose. So regardless of how diverse, if we're all united in one purpose, definitely we can collaborate multi-sectorally to come up with sustainable solutions and progress to our healthcare system. So to summarize what we can do as youth, we can play key roles in community engagement and mobilization through even youth networks. You would notice for most of us who grew up from villages, whenever they send you for education, when you come back, you become a powerful voice for everyone else in the village because they know they've sent someone who is now a scholar. So you become that powerful voice. And I guess youth must take advantage of that to be able to do so much of community engagement through education, picking up tailored topics, including, dispelling rumors about vaccines in order to, turn the tide of vaccine hesitancies and other public health related challenges that we face in our communities. The youth can also serve as a powerful voice for advocacy and activism. Civil society organizations for a long time have been at the forefront of advocating for the marginalized, advocating for policies for disabled people, and a whole lot of other public health related issues that confront us. And I guess the youth can play a key role in that advocacy role due to the fact that the youth has a more powerful voice. And just to digress a bit, that you would notice in Kenya when there was that Gen Z phenomenon that was happening, you could see the power of the youth in compelling certain changes, even in a political landscape. So that highlights the fact that the youth can be a very good driver for change through youth advocacy and activism. Then, of course, youth-led initiatives and the issue of volunteering, to participate in public health related programs. And I guess Nuha and myself, having volunteered as African CDC Health Volunteer Corps, is one key example. You can always volunteer through regional bodies, local NGOs, and several other multinational organizations to lend a helping hand in terms of volunteering to either emergency response or any other public health related challenge that you may find in the community. And finally, the youth must be encouraged to pursue careers in public health, careers in research, because it's through effective research that we will be able to unearth the relevant context-specific solutions that we'll be able to use to overcome our challenges as an African setting. And I'd like to end here with this quote that the brighter future we all desire for Africa would be driven by the youth. So it's up to us, the youth, to take charge of youth leadership through the various roles we can play. And once we take charge of this, there's that potential of a massive change that we can drive across the public health landscape in Africa. And this was just last 2 weeks when I was in Ethiopia at the African Union. This quote really attracted my attention. And that was a quote by my first president, Kwame Nkrumah, the first president of Ghana. And he said, Africa must unite. So I want to leave you on this note with this quote that we must unite in our efforts in addressing public health challenges that have confront the African continent. We must unite in research, we must unite in emergency response, and we must unite in knowledge sharing in order to be able to overcome the challenges that confront us as a continent. Thank you very much once again for inviting me.
I believe everyone has gained a few things from this presentation. He presented to us about the ongoing African public health challenges, and also the status quo of the public health as a whole throughout the region from different perspectives that he has. And thank you so much again. We are going directly to the next speaker. Her name is Destiny Chukwu. She's a Nigerian global health practitioner and results specialist with over 12 years of experience leading learning initiatives to improve health outcomes for vulnerable populations. She currently serves as the monitoring, evaluation, and learning advisor for the health campaign effectiveness, or at the task force for the global health. She has a background of working for 6 years at the Clinton Health Access Initiative and supporting vaccine programs. She also holds a Bachelor of Arts in Interdisciplinary Studies from University of Arizona, and she has a Master's of Public Health in Advanced Biostatistics and Epidemiology. Today, I really want her to speak about her journey throughout public health because she is raised in Africa. She's one of our sisters, and she has quite a great journey in the field of public health. And so she will make a speech about, she will speak on pursuing public health and research profession as an African youth. And she will also share her success story of joining public health program at a top level college, for example, in Europe. So Destiny, I will leave the floor to you.
Thank you very much, Ebenezer. Hello, everyone. Again, I want to be here today. I think first and foremost, I just want to say that I was once sitting exactly where many of us are today, very curious, and determined to make a difference in public health. Just gleaning on my dear colleague, Dr. Engelbert's presentation, the final slide, one of the areas that he pointed to, which is important for our own consideration of how we can be involved, is how we are focusing on our personal development and our career in public health. So as an African youth, we don't just represent the future of global health leadership. You can see from the statistics that were shared in the last presentation that we already are the present, and the work begins now, and it begins with us. So I'll share a little bit about my journey. My academic journey actually started with a bachelor's degree in interdisciplinary studies. You may say, why not medicine? Why not, some of the usual tracks? But for me, I was really interested in exploring, the intersection between health, society, and policy. And it revealed to me how deep health is shaped, not just by medicine, but just gleaning on this previous presentation that it depends on systems, it depends on the environment and power, social, cultural structures that exist within our continent. So through that program, I was given the opportunity to do an immersive program, a public health program in a country called Uruguay. And maybe many of us don't know, but we actually do have brothers and sisters who are of African descent in Uruguay. And one thing that came out very interesting is that having worked with these communities, especially the youth communities, is that many of them were living in under-resourced neighborhoods. And I'm not just talking about money. Being under-resourced also speaks to the lack of access to basic information, even about sexual and reproductive health. And unfortunately, that placed them at higher risk of, higher risk for STIs and unplanned pregnancies. And I didn't just witness these health challenges in Uruguay, but it's something that I also witnessed within my country of Nigeria, seeing how social determinants like income, geography, do you live in the northern parts of the country? Do you live in the southern part of the country? Your education, how these actually are woven into every individual's health outcomes. And it made me ask a bigger question. Why are these health systems failing? How can we use evidence or research to inform solutions? And that's when I knew I wanted to pursue a career in public health, one that was grounded in equity, systems thinking, and evidence-based change. So just looking for, local passion and where did these global opportunities lie. Like many of you, I had concerns. I suffered from imposter syndrome, feeling like I was inadequate sometimes to a lot of my counterparts who come from the global north, from Europe or the likes. And I just had to ask myself, how do I build a global health career coming from Africa? Where do I start if I don't go to if I didn't go to a famous university? And can someone like me get into a top public health program? And I want to make it very clear that yes, you can. All things are indeed possible for you. And it requires a couple of things. One, it requires clarity, a good strategy, and you have to be resilient, which many of us as African youth are. So eventually, I was accepted into a very competitive program in Europe through the Erasmus Mundus Euro Public Health Master's Program. And this gave me the opportunity of pursuing two master's degrees. So the first one was in European Public Health at the University of Sheffield. And if you're familiar with University of Sheffield, it is a prestigious Russell Group and Red Brick University, which is recognized for its academic and research excellence. Then the second degree that I did get was in a specialization in advanced biostatistics and epidemiology from the French School of Public Health in Paris. And why that is important for us as Africans is that this particular university is very well recognized within the confines of the Francophone African public health space. So it was an opportunity for me to really strengthen my networks and opportunities beyond just the Anglophone Africa, and how I could work closer and build and strengthen relationships with even other Francophone Africans, because we know that sometimes language barriers have limited us as Africans to be able to come together. So you're not asking me what are a couple of tips to be able to go to some of these very interesting and prestigious institutions. The first thing is you need to have a clear purpose. You have to ask yourself, when considering what admission committees and future employees are looking at, they're not just concerned about what you've done, they actually want to understand your why. So you need to take a step back and ask yourself, my why. My why was deeply rooted in the painful reality that too many African communities suffer from preventable health issues. I know that many of us in this call could probably identify one or two stories where we have directly been impacted by the personal loss of a relative because of negligible access to healthcare. And not because we lack solutions, we do have solutions, but it's just because those solutions are not reaching the people who need them. And indeed, that is an injustice that fuels the work that I do every single day. Then the second thing that's important is the storytelling. One beautiful thing about a lot of our African communities is the richness that we have in our oral traditions, right? And that should really feed in the reality of you sharing your story when you're putting your admission paper together. So when I applied for graduate school, I didn't just lead by saying, oh, I got all A's or my GPA, but rather I led by my story. I talked about growing up in an African worldview and working on the ground in public health programs, and how I wanted to bridge local insights with global frameworks. So your story is your strength. So what I want you to do is to lean into your story. And thirdly, the most important thing, there's that proverb that we hear that it's a community that raises a child, right? So in the same way, we take that same guiding principle to recognize that we need to reach out to mentors. We need to reach out to people that we know in our countries. We need to reach out to people that we know globally through platforms, online platforms such as this that we have available, right, through the World Federation of Public Health Association. And take advantage of these webinars, take advantage of the conferences that may come across you. And even like Dr. Ingobot had mentioned, the value of volunteering. You may meet people there that have insights, that may have contacts, that may provide you perspective to really shape how your application and what the future looks like for you when you're pursuing your graduate or future studies. And do not underestimate the power of platforms such as LinkedIn and even Instagram, because you can contact, professionals doing some of the fantastic work that you indeed admire. And then another thing I would like to say is that what African youth bring to public health, because indeed, I already mentioned that sometimes we look down on ourselves, but we need to understand that we don't have anything to prove to anybody. Right? I want us to understand that we do not need to prove our worth to global spaces, but rather I want you to flip that narrative. We don't just belong to the table, but we bring something unique to it. We are very resourceful, often doing so much with little resources. I'm sure that you have your own personal stories or experiences where you've gone to health facilities. You will see that it's only one health worker that is providing more than 5 different services. Sometimes they're even just community volunteers. Another thing that we have the system thinking, being able to navigate complexity. Sometimes if you volunteered in a health facility, there's no lights, there's no water, but somehow the services that we need to provide need to happen. Or maybe you've worked in policy development where you've had to consider some of these factors. So that's another resource that we have to an advantage. And another thing is that we carry cultural wisdom and we have lived experiences that global health institutions increasingly recognize as essential. Gone are the days that the high global health institutions are the ones pushing down policies. They're now sitting at the table with our lives, with our communities, with our people to understand what are the best solutions, what are the tailored interventions that are indeed going to reach our people, which I think is something that is fantastic. And I think if I have to go back and give advice to myself and then also you who are listening to is one, do not wait for permission to lead. Take advantage now. I want to commend Dr. Ebenezer for just being an example of that. He realized that our reputation was limited and he went ahead and he pushed forward to be able to lead and initiate and give birth to this platform. So I just want to say that's just an example of that. And then the truth is in life, nothing is linear. There are times that we are going to be faced with failure, but you know what? It's not rejection, but rather a form of redirecting you. You have not been defeated. The third part I would say is our African identity is our superpower. Your background, your language, your local knowledge, it's an asset and it is never ever a barrier. And the final part is always dream big. But while you dream big, just break up your dreams into initial steps, practical steps to be able to make that transformational change. And now I'm closing because I know my speech has been quite long. So, but rather, what does this mean for all of us? It means for you, it means for us as African youth, students, researchers, emerging professionals, that we're not waiting to become leaders someday, that we already are leading. And your questions, your drive, your presence here, indeed, they really do matter. So this webinar is just on another event. See it as a signal, see it as a light, that this is the time for African youth in public health, not for tomorrow, but for today. So let's invest in ourselves, let's build together, and let's keep asking, what can we transform when we lead boldly, work collectively, and center equity in all we do? Thank you. Merci. Shukran. Asante. Nagode. Namaste. Ciao.
I'm really happy that you know I'm Sekinalo because I'm from Ethiopia. Thank you so much, Destiny, for this amazing speech. I'm proud to be an African because when you grow up in Africa and also when you also be part of the health system, understanding public health will be second nature. You will understand how preventable diseases and also how educating the community is going to reduce significantly the public health problems that we have. And then when we will have public health leaders who achieve unimaginable things for people around us, and then when they come back and also provide back to the community, it would be amazing because it's a motivation for all of us. That's why I had the vision of preparing this opportunity and also panel discussion to absorb and also give back to the community that is waiting for us, for the challenges that are waiting for us to be solved. So it's going to be a very good journey for us, and also I hope everyone took a few lessons from the journey of Destiny. I hope we will have more discussions similar to this in the future. The next speaker is a close friend of mine, and she has also been someone I look up to. She is from Sudan. She's freshly graduate medical doctor. She has a very good, an amazing journey. She has a background in global health research, digital health, maternal care, and meaningful youth participation. The amazing thing about her is she's really a research enthusiast. She has more than 14 publications as a medical student, which is something unimaginable for us to achieve. But besides that, she has been working under the International Federation of Medical Student Associations for 2 terms as the External Affairs Regional Assistant for Africa. She has been actively advocating for digital transformation of health systems and also integrating SRHR education into healthcare frameworks. She has been part of the 74th and 75th World Health Assembly and also UN high-level political forums. She has also worked in different global health initiatives, more than 16 of them. And as you can imagine, she has a very good extensive experience in public health leadership. So today she will be discussing about meaningful youth engagement and in Africa, and also integrating our the role of culture, intra-regional collaboration, and also acknowledgement of youth as equal partners in achieving health equity in the African region. Dr. Fatma, I will leave the floor to you finally. Nice seeing you.
Hello, everyone, and thank you so much, Abenzer, for the warm introduction. It's really nice to be back again to youth spaces for discussions about meaningful youth participation, a topic that is very close to my heart, as I was advocating for meaningful youth participation in many high-level events with many partners when I was part of the IFMSA. We will be discussing basically the different types of youth participation and the role of regional collaborations in youth engagement. So let's start by a very simple and quick question for all of you, especially the young people attending. What does youth participation mean to us? What do you know about the concept of youth participation based on the discussion that we had with our previous 2 speakers and based on your previous experience and knowledge as well?
Okay, thank you so much for giving me the floor, Mr. Noah Fofana. Good afternoon or good evening where you are. So I'm Dr. Sabo Boleno from the Republic of Guinea, Conakry. So for me, youth participation means a lot. It means that youth, let's say, are the backbone of the health, because their involvement can drive meaningful change in the community. And their involvement can start from the beginning of the policy that, for example, we are trying to initiate, we are trying to implement, we are trying to bring to the parliament, for example, for the inauguration, for example. So, and also apart from that, youth participation can be even at the local level. For example, how we engage our community in health initiative. For example, when you take EU Bingwa initiative, which is something very powerful now, where young people are included, where young people are involved, where young people even initiate themselves some health initiative at local level, and they try to implement them. So they can also be involved, for example, in bringing this health initiative or health measures or health communication to the communities, because we have different perspective, we have different background, we have different understandings. And now with the digitalization, for example, youth are informed on time, and this information can be brought to the local communities in order to have a meaningful change in the community. So for me, I think their participation is at different levels, from the initiation to the implementation to the monitoring and even the sustainability of health programs that we are implementing. Thank you.
Thank you so much, Sa, for sharing. And I believe that the points you mentioned are already covering many points that I'm going to discuss during the presentation. So speaking about the definition, I really prefer that we talk about meaningful youth participation and define meaningful youth participation at first, because it is the ideal form of youth engagement in decision-making process and in shaping their communities and health agenda as well. So after that, we're going to distinguish between the different levels of the meaningful participation and the other non-meaningful ways of engaging young people, which we are highly against as youth advocates. So meaningful youth participation refers to the active, informed, and voluntary engagement of youth in decision-making process that affect their lives, communities, and societies. So it goes beyond tokenism, and tokenism is one of the non-meaningful ways of youth participation that we will discuss later, by ensuring that we as youth have genuine opportunities to influence the outcomes, share power with adults or decision makers, and contribute to shaping policies, programs, and initiatives. So this definition is quite comprehensive, because when we break it down, we can come up with other important concepts that we're gonna discuss in the next slides. So I'm going to move on directly to one of my favorite frameworks in explaining meaningful youth participation. So we have this beautiful flower. It's called the flower of participation. It is a very meaningful tool to explain how we can make our participation as young people flourish, and how can meaningful youth participation be threatened by other external factors. So we can start from below. So below we have the roots of the flower. So the roots of the flower represent the core elements of meaningful youth participation. So here we have the voice, the decision-making power, responsibility, information, and freedom of choice. Then we move upward. We have the leaves and the petals of the flower, and they represent the different levels of meaningful youth participation. So here we have young people are appointed in a role and informed, and young people are consulted and informed. Here we have youth-led activities with adults having no decision-making power, adult-led activities with shared decision-making with young people, and youth-led activities with sharing with adults. And here we have youth-adult partnership, which is the ideal way of engaging in decision-making process with adults and young people. Also, we have the sun and water, and they represent the preconditions that we need in order to maintain and sustain the meaningful youth participation. So here we have capacity strengthening, we have commitments from adults, we have policies, financial support, safe spaces, friendliness, and flexibility. And the air and soil here represent the fundamental principles for meaningful youth participation. So the soil represents the commitment of young people, and the air represents inclusivity. And lastly, we have the ants, as you can see here, and the ants represent the non-meaningful type of participation, which are the manipulation, tokenism, and decoration, which we will review later. So this flower is created by Choice. So Choice is an organization based in Netherlands, advocating mainly for SRHR rights. And this flower is a very comprehensive figure that you can use if you want to explain the concept of meaningful youth participation, contributing factors, and risk factors, which threaten the sustainability of MYP as well. So I highly recommend you to take a screenshot of this presentation and use it in your future advocacy with the decision makers, and also to capacitate your peers about this topic as well, because it's very important. So next, I'm going basically to list the leaves and petals that we discussed. So we have young people being assigned and informed. We have young people being consulted and informed. And then we have youth initiated with no adults contribution. We have adult initiated with shared decision with young people. And we have youth-initiated we have adult-shared initiatives with no youth contribution. So what we have to do as young people is to advocate for equal and meaningful partnership between youth and adults, because basically adults or decision makers have the capacity, they have fund, and they have more experience that we do. But at the same time, as young people, we have motivation, we have time, we have fresh and new ideas. We are also better at using technologies, and we are making the majority of population today, as well as the majority of population in the future. And we are basically the next decision makers and leaders, health professionals, politicians, and so on. So it's very important to advocate for this equal partnership, because it is the ultimate way of meaningful participation that we want as advocates. So regarding the non-meaningful ways of participation, we mentioned manipulation. So manipulation is when young people don't understand the issue and the role in that process. So as you can see here, we have this malpractice, and it's ordering the young people to hold the sign and protest. And they are asking that they don't understand exactly what they are doing and why they are doing that, but it's just ordering them to protest without asking any questions. So here, young people are being manipulated without understanding the exact issue and their role in the process. We also have decoration, and decoration is basically when we put young people at display during an event so the media can capture them and reflect a specific organization as a youth-friendly organization, despite their non-meaningful non-meaningful engagement of young people. So this is what we mean by decoration. It's basically having young people for the sake of media and public display without any sort of real engagement. And lastly, we have tokenism, which is about young people are apparently having a voice, but they have no opinion in communication style or taking decisions. So I'm going to give you an example. One of the important things that we advocate to as young people in United Nations is for governments and countries to adopt something we call Youth Delegate Program. So many countries have good policy when it comes to engaging young people within the Youth Delegate Program, but other countries engaging young people without inviting them to the delegation meeting, without taking their opinion and point of view when it comes to voting or taking real decisions within the UN spaces. And they are basically doing non-meaningful tasks like preparing some documents or just like writing specific minutes without actually giving any inputs or taking their opinion into consideration. So this is what we call it tokenism. It is just basically about giving people, specifically young people, a space or a position, but they are not being engaged meaningfully, and they are not utilizing the position as if it should have been. So next we will talk about how do regional collaborations foster meaningful youth participation in Africa. First of all, we have the policy influence and advocacy power. So in the African region, we have important regional bodies like the African Union. And from the African Union, we have other important organizations. For example, we have Africa CDC, which is a very close organization to us as health advocate and young professional in the medical field. So these regional bodies have stronger influence in advocating for youth rights and inclusion through collaborative advocacy. So as young people, we can shape regional youth charters and framework. For example, we have the African Youth Charter, and also we can push for national policies aligned with regional standards on meaningful youth participation. So this is an approach that we can use. Secondly, we have cross-border youth networks and solidarity. So regional initiatives enable the formation of youth networks and alliance. For example, there is the African Union Youth Envoy Network, the African Youth Commission. I also remember that Africa CDC had Youth Advisory Board in health-related matters. So these are examples for cross-border youth networks and solidarity. These spaces could be utilized for the sake of shared learning on youth participation models, joint campaigns, capacity building programs, peer mentorship across countries, and many more potential opportunities. We also have capacity building and skills development. So the regional organizations often fund or organize programs that build leadership, advocacy, and policy literacy skills. And they offer fellowship, internship. For example, there is the African Union Youth Volunteer Corps. It's a very important and essential program for young people to apply to, especially who have a really good track in volunteering. And also we have the support for youth-led research or innovation in governance and development. And I believe that the research point is also very important because in a very general way, in the health system related issues within the African region itself are under-researched. That's why we are still developing in the majority of the countries in many areas. Also, we have many factors which determine our capacity to conduct researches like conflict, wars, political instabilities that we have within the region. So it's very important to invest on young people, make sure that the young people have enough capacity building to contribute to research, which will lead eventually to a change in policies. And by the end of that, we will have a total change in the governance structures and health systems structures according to our regional and national needs. So in conclusion, I really want to conclude with this quote from the UN Secretary General Antonio Guterres about meaningful youth participation. So we must build on the work of member states, youth envoy, and civil society, but this can be an initiative by old people discussing the young generation. The United Nations must empower young people, increase their participation in society, and their access to education, training, and jobs. And I believe that the call to action that Antonio Guterres raised in this speech is basically not only to United Nations member states, but it's also for our African countries, for African organizations, as well as us as young people, because we have to advocate for our right, even if decision makers are not giving us the spaces that we need.
Thank you so much, Fatima. This topic is really crucial to me because over the past few years, I have been noticing the real importance of meaningful youth engagement, because as Africa, it's easy to be manipulated and also for our voice to be shut down while being, when we can be the solutions for the lot of problems that we have. I have been part of a few programs that just gave $5 or $3 or $14 just to take pictures of youth, and then later on report it as if they engaged youth in a meaningful way. Most of the programs or most of the NGOs that have programs in Africa, they just as Dr. Fatima said, it's just tokenism. It's just nothing for the benefit of the youth, nothing for the community of around them. Most of the things are just to say they have engaged youth or just for reporting. But as I think we can be the solutions to this. We can be, the voices, because we really understand the problems that we have and the solutions that we need. All we need is the capacity building and also the right way of support. If we are provided the skills, if we are provided the opportunities to speak on behalf of the people that we do represent, and if we are also provided the monetary support to implement programs that we do believe in can change the different challenges of the public health, that's what meaningful youth engagement means to me, because if I am really provided the right opportunities, I believe I can do anything as much as any person across the world. I'm not more or less than any person across the globe. I just lack the rightful the right resources and also support. And for Africa, this is the major problem that we all share, I believe. And I think most of us share this feeling in our hearts, but we are the ones who can push to those voices if we are provided the right platform. So with this, I will give the floor maybe for questions. Nuha, my brother from Gambia, who is a field epidemiologist, he works in the Ministry of Health in Gambia. And we have also Dr. Luando, who is going to speak to give closing remarks.
I think the speakers were excellent, and the future looks bright. I do have some questions, and maybe also to stimulate thought, and I'd like to hear from each of the speakers who are present. So the first one is, I mean, advocacy in the African context is, it's not as straightforward as in Europe or the North. We have challenges of corruption, we have challenges of physical harm to the advocates. People disappear. And I want to say to that to everyone who's online that it's good to do that, but we also have to make sure that you as the speakers do give advice to them relating how to mitigate that and how to be aware of that, and also to understand that it can happen. And it might be one in terms of disappearing, or it might be from a hospital level, career progression stops. And one might not pass exams anymore because they're seen as being disruptive to the current status quo. And I'd like for you to answer that in terms of what do you share advice for that. I will come back with comments at the end when I close the session. The second one is that I didn't hear anyone touch on radio as a medium for advocacy. You can get it more people in contact with communication. It's still a very important thing that you need to address. And if any of you have examples of you doing that or finding to assist that, they'll be glad, because internet and Wi-Fi and so forth come with data. And that's also a challenge in Africa sometimes. In terms of getting access to internet and reliable and consistent internet. And also it can be switched off depending which country. I think the mere fact that you are all speaking here don't belong to some of the countries which have very dominant and very tyrant regimes where there's a complete wipeout of internet depending on what's happening in protest. I mean, the most recent example was in Mozambique when there was riots happening and there was a lot of the youth who were protesting and also trying to make the world aware to what's happening, and they limited access. And then the last one would be in terms of understanding that I want you to also address imposter syndrome. A lot of people from the global south, not just only Africa, from lower income countries, get to these platforms and they doubt themselves and their hard work and how you got there. And it might even speak to yourselves who are online right now, that it's fine, it's a purely dominant African meeting, looking at the speaker list and also looking at the guests, but you'll get to different platforms on a global scale. And you need to also advise them how to stick to it and share examples how you, if you've had been in those exposures where you are now competing with the global village in terms of platforms with other youth members trying to push their own agendas, and how do they mitigate pushing the African agenda, because you get to these platforms and unfortunately, African problems are seen as something that they don't get used to. It's a foreign concept and they don't understand the challenges Africans face. And you still have to make sure you push your mandate because you are at these platforms, each of you representing a constituency that has real problems and has real solutions and wants to get support and advice for that. So those are the three things. I'd like to hear what the panelists have to say, and then we can wrap up. Thanks.
I guess I'll start off with the first question that you asked. I guess it's very true that in our various countries and settings, there's often this issue of either political victimization or even in institutions when they see that, a particular youth is quite loud on issues and trying to draw a good following, people try to find ways of silencing you. So for me, there are certain key things you could do in order to avoid some of these negative issues that you might encounter. So first of all, trying to pick your battle carefully, trying to stay focused on the issues that you wish to, play advocacy on, and avoiding, politicizing or bringing in controversies into the kind of issues that you wish to discuss. So this will also include you trying to get your facts. So in handling your issues, you are communicating facts. And when you are communicating facts, you definitely would avoid some of the controversies that might draw you into some form of political crisis. So I guess that's the one thing, getting your facts right and sticking to the facts in your advocacy so that when people want to confront you, you really have enough evidence to prove your point. I guess it's also not out of place to have some form of backing or support from some powers that be, because in every situation, sometimes we do need a higher authority in a way to support our cause. So I guess there's nothing wrong in even having such a following to back you up, even if it has to do with legal, following or legal support, there's nothing wrong with that. So that in case you inadvertently still find yourself in deep waters, you can be supported to get out of it. So these are the few thoughts I think I would share, but mainly the take home will be to stick to the facts and try not to delve into political controversies.
Maybe the next speaker can take the other question relating to, they can choose either one relating to radio as a media platform for advocacy, or the third one about imposter syndrome.
Yeah, so I can talk about imposter syndrome. Basically, as a young person, I graduated recently from med school 3 months ago. And I have been working in the International Federation of Medical Students Association as External Affairs Regional Assistant for the African region. I was doing also many advocacy actions for more than 4 years within the Federation itself. So I had the opportunity to work with multiple people. Some of them were African young people, some of them were non-African young people from other regions like Europeans, Americans, Eastern Mediterranean, and so on. So in the environment of the IFMSA and other youth-led organizations, sometimes the work itself could be competitive. It could affect your mental health, and you can easily feel some doubts about your actions, and you might end up with imposter syndrome. So I will just share some tips for the young people who are attending about how I was able to encounter that and always try to direct myself to get back on track whenever I feel lost and not knowing what I am doing. So basically, you always have to remember your why and your internal reasons behind what are you doing. Because many people feel overwhelmed. They start to question themselves and they don't know exactly why are they doing this and for the sake of what. So we all have different motives. Some of us have genuine internal motives for the sake of improving their communities, improving their societies, supporting their peers and so on. Other people might seek merely the career advancement and other external motives. So it's totally fine to have different types of motives. We are different people. Of course, we will not have the same priorities and motives, but you have always to remember yourself about your goals, your priorities, and real motives, because I believe that this is more of like a redirection whenever we feel lost. So this is the first thing. The second thing, always remember that being engaged in youth spaces could be competitive, especially if you want to raise your voice to global leaders and decision makers. But at the end, this is not a battle. You are here to learn, you are here to grow. So always ask for a feedback. You can seek a mentor. This mentor could be one of your colleagues, for example, who you trust his opinion, or he could be a senior to you at work, or anyone you trust their wisdom. This is very important because sometimes we can't see our own mistakes, but others can redirect us and be honest with us. So it's always about growth mindset. It's always about seeking feedback and mentorship to improve from like a professional perspective, and also from a personal perspective, to have more like ethics, integrity, because these are the core principles of teamwork, youth leadership, and so on. Also, it's very important to take care about your mental health. It's very important for organizations to set specific frameworks to check on the mental health and the performance of the volunteers or employees. Also, it's very important for you to take care of your mental health, even if your organization is not mental health friendly. You can seek a consultation, or you can contact like a psychologist. Sometimes taking a break is just enough to reflect on your previous actions.
And also speak on the role of radio and also communications. So in December, I was part of a radio show for the 16 days of activism against GPV, representing both youth and also my male counterparts. And on that experience, what I understood was, even though like we are at a time of digital transformation and most of the things are related to technology, we should not forget our roots, because in Africa, almost most of our population are still using communications like radio and also television to disseminate information. So at the same time, we should also understand the role of disinformation, where they get those informations, and also how they are delivered are also really impactful. So for me, I understand that we should not forget utilizing those tools to disseminate information and also teach about public health. So when you compare the total population with the which uses these types of ways of communication, like social media, like Facebook, TikTok, Twitter, and all, I don't think it would compare to the amount of people that still uses radio and also television for to gain information. And the credibility of those sources is really impactful, because I have seen how much these things can really be the solution and also the cause for different issues. For example, in my country, we have been going through internal conflicts for quite a few years, for the past 5 years. And what was happening was the region which was having internal conflicts, all sorts of communication was closed, and they were only getting information from television, which was was being manipulated by the government, by the regional government that was around there. And all the people relied on that information. Whatever it is, they had to trust what's going on. But the problem was, what was happening outside was quite different from that. So people really value those people who are speaking on the radio, who are speaking on the television, more than what's being disseminated on the internet. And when we are the ones who are gaining the opportunity to those on those platforms, we should utilize it in a meaningful way, which means we should really disseminate the right sources of information and also the right knowledge that we have, rather than utilizing that for the agenda or anything that would negatively impact those who are on the receiving side.
Thank you for sharing those, and it's very important to address these things. And I think that you've given a message that can be for hope and for those who are part of Africa to unite and be able to progress forward in terms of improving and not forgetting why they're there. That it's all about the constituencies. And when you are in these meetings, you must always remember that you're not representing your colleagues just in your medical schools or in your organizations. You're representing the most person in the most rural area with the least education and the least resources available to them. And you need to always remember that. And I thank you all for being online today. And I do invite all of you to apply later on the year for the World Congress of Public Health, as I'm hosting it in South Africa. And I hope I will get to see you and also attend the ISMOF meeting hosted by the Young WFPHA. And it's been quite exciting, and we'll have a strong African influence in it and a strong African agenda. And with that, I'd like to thank everyone. Thank you for organizing, Ebenezer, and I wish you all well.